President Trump will be released from the hospital in just a matter of hours, but he'll continue to undergo round-the-clock treatment for COVID-19 at the White House.
Yeah, and that comes as more members of the White House staff test positive even today. ABC's Elizabeth Schulze now live outside Walter Reed Medical Center. And Elizabeth, you've got the latest from there today.
Yeah, Brian and Jeanette, President Trump says he will leave the hospital at 6:30 p.m. tonight. He says he's feeling good. The White House physician just gave us an update here. He said the president's symptoms have gotten much better. He is good to go to the White House, but he's not out of the woods yet.
4 days after he boarded Marine One to Walter Reed Medical Center, President Trump tweeting he's leaving tonight, saying he's feeling really good. And despite undergoing treatments including supplemental oxygen and experimental drugs, the president saying don't be afraid of COVID, don't let it dominate your life. His physician giving this update.
Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home, where he'll be surrounded by world-class medical care 24/7.
The president set to return to a White House that is now its own COVID hotspot. Press Secretary Kayleigh McEnany revealing she tested positive for the virus this morning. ABC News has learned at least 2 other White House staffers in the press office also got positive test results in recent days. McEnany briefed reporters as recently as Wednesday without wearing a mask.
This has been answered yesterday by the president himself.
And sources tell ABC News McEnany was pulled from the president's trip to Bedminster, New Jersey last Thursday because of her proximity to top aide Hope Hicks, who also tested positive. The press secretary, just the latest member of the White House staff to defy CDC guidelines requiring individuals to quarantine if they've been exposed to someone with COVID-19. President Trump violating the health agency's recommendations last night during a surprise drive-by to wave to his supporters outside the hospital. The president, who health experts believe is likely still contagious, wearing a mask in the back seat, but that vehicle is sealed to protect against chemical attacks, meaning the air inside doesn't circulate, putting the Secret Service officers in the SUV at risk. The White House saying in a statement appropriate precautions were taken, including PPE. The movement was cleared by the medical team as safe to do. But the CDC says any movement of a hospitalized COVID patient outside their room should only be done for medically essential purposes. Doctors say President Trump is responding well to the antiviral treatment remdesivir and to a steroid called dexamethasone, but the use of that steroid raising questions about the severity of the president's condition. The National Institutes of Health recommends it be given to patients who are severely or critically ill, and by lowering the immune system can potentially cause further damage to a patient's organs.
Now, President Trump's schedule after he gets back to the White House is unclear at this point. We don't know if he'll be staying in while he's there. The president has said he's eager to get back to the campaign trail. We are just away from the election. Biden said today he's looking forward to that town hall debate that's scheduled with the president next week, guys.